And that is, I think, what terrifies the patients is that if the doctor says that there's nothing serious wrong, that means that the physician is no longer going to monitor the symptom. That the kind of surveillance function of the doctor to be on the lookout for something new that might emerge is no longer going to be followed. The doctor is just
Right.
going to abandon that. They've dismissed it and they're not going to be listened to anymore, which really further scares them.
That
Yeah,
adds to the fear.
we're actually doing a study here at Columbia jointly with Arthur in Boston, and one of the things we're very careful about is to make sure that indeed people don't have something physical wrong with them. So we actually do a fresh review of their complaints. A physician actually evaluates them with a good physical exam, a review of some of the historical blood tests, as well as drawing our own blood tests to see if in fact the person is healthy but overly concerned about illness.
So being very thorough about
Yeah, you
that as
gotta be.
well.
You gotta
Good.
be. Maybe we should stop at. What do you think?
Well, I had one more question. So we've talked a little bit about what are some of the beliefs of people with hypochondria, but also what about what are some of the behaviors? We talked about sort of frequently checking with doctors. What are some of the other behaviors?
I think Brian and I both feel that one of the most difficult situations is surfing on the web, looking on the internet.
Ah,
Because it's
yes.
almost, you can't help. The minute you notice something, you can't help but wonder what might be causing it. And
Sure.
you Google the symptom.
Yeah.
And the problem is that most people do that hoping that they're going to be reassured. They're going to learn, excuse me, something that makes them feel better about it. But almost inevitably, patients will tell you, if you really ask, that they're far more anxious and worried and alarmed by the time when they finally turn the computer off than they were when they started. Because what happens is you just learn about all the myriad of awful, rare diseases that could be causing it that you never even heard about.
Right.
And then you start to wonder, well, maybe the physician doesn't know about those either. And so I think looking on the internet is one of the key behaviors that seems to fuel it, perpetuate this kind of thing.
Yep, that's a bad one. And they call it cyberchondria, right? That's
Right.
that's
Right.
that's the
Right.
term that they've used for it. Actually, one of my younger colleagues, Emily Doherty, is doing a study of cyberchondria, and we'll have a web page soon which tells you about that, so you can check that on our website. Another type of checking is bodily checking. So sometimes people check their bodies, uh, once a day, or 10 times a day, or 20 times a day. They may look in the mirror for signs of melanoma, or they might, that's a type of checking, or they may check with family, friends, sort of in a subtle way. Say, I had this pain in my shoulder, what do you think it is? And they laugh about it, but they're listening really carefully to see what the friend says or the family member says. Now, the family members are wise to this, and they're fed up with the checking, but it's based on that fear that they do that kind of checking. They also avoid, which is another kind of behavior, which is they avoid anything that some of them do, at least anything that might remind them of illness. So some people think of hypochondriacs as constantly going to doctors. Well, some of the hypochondriacs actually avoid going to doctors
Right.
because they're so terrified of what the doctor might find. So I remember one woman who was terrified of coming in, and she was so anxious that when she had her physical exam, her blood pressure actually did rise to a frightening level, and it was only because she was so anxious. Uh, the avoidance of doctors, and what else do they avoid,
Well, I
Arthur?
think it's this interesting process in which once you believe something's wrong, you just look for information that confirms your beliefs.
Right.
You pick out the things that agree with your suspicion and you dismiss everything else. And so they will ask anybody in sight, did you ever know anybody who had this symptom and what was wrong with them? And the first 20 people will say, well, nothing serious. But then finally, they'll keep going until finally they have a coworker who says, well, I knew someone who had that, and it turned out they had a stroke.
Right.
So they just keep going until they finally find some information that confirms their suspicions. And of course, it just alarms them all the more. So asking other people for reassurance, examining yourself, researching your condition, all that sort of stuff often can make things worse.
So, I actually wanted to come back to something that you said, Dr. Fallon. As you were talking, you sort of chuckled that families sometimes are fed up, and I think that raises the point that sometimes, especially in the media, it seems like hypochondria is sometimes portrayed as something that's a laughing matter or
Oh
something to
boy,
be
that
dismissed.
certainly is true. Um, What are some of the popular shows? The Seinfeld show. There's good examples of hypochondria in the Seinfeld show. There's Woody Allen, another good example in his movie Hannah and Her Sisters of hypochondriasis. And why is it that I mean, nobody laughs about other diseases? Why do they laugh about hypochondria? And I think it's partly because hypochondriacs have the insight to know, at least some of the time, that their concerns are not real. They have a certain amount of insight, so when they present them, they present it in this joking way to try to get the information from their family and friends, but they don't want to reveal the true terror because people think it's absurd. Do you have any other thoughts as to why do people laugh about hypochondriasis?
Well, I guess this is a little more at a philosophical level, but I think that people believe that if there's not a medical explanation, that means you are faking, that you are imagining your symptom, that quote, it's all in your head.
Right.
So that it's this kind of dismissive response because we say you're malingering, you're just fooling yourself, you're just imagining it. That somehow a symptom, pain, that doesn't have a medical explanation is illegitimate. And that's often what hypochondriacal people find so distressing is they really want some legitimacy, somebody to say, yes, indeed, you are suffering.
Right.
It may not be from a serious disease, medical disease, but you are suffering. And that tends to be not our response, is if there's not an explanation, well, then it's just a joke.
Maybe we should stop.
Okay, sounds good. Well, we'll continue on in future segments.
Great. Okay. Join us for the other segments on what is hypochondria, history of hypochondria, treatment of hypochondria, and one of our last segments will be an in-depth description of our research study that Arthur and I are jointly doing. Thank you for joining us.